You're listening to Amrita's story, a son with GERD and food aversion. Hi, and welcome to the Child Life On Call podcast. When your child is sick, the whole world seems to stop in its tracks. Plans and priorities change, and your number one job becomes figuring out how to get your child well again. For some of us, rest, medications, and relaxation can do the trick. But for others, it takes more. It takes countless doctor appointments, invasive medical testing, therapy, surgeries, the list goes on, and then you still may not have all of the answers or results you were hoping for. This podcast features parents of children that have an illness or medical condition and gives them a place to share their own journeys and experiences. We will talk about the ups and the downs, the highs and the lows, but one thing seems to remain the same. Children are resilient and teach us more about ourselves and the world than we could ever imagine. Thank you so much for lending a listening ear and opening up your heart to these families and this podcast. I'm your host, Katie Taylor. Hello and welcome to the Child Life On Call podcast. I am your host, Katie Taylor, certified child life specialist, and am here to share stories from parents with you. If you haven't already, please rate and review this podcast whenever you listen. More reviews make it easier for families to be able to find us. And also follow along with us on Facebook and Instagram so you can see the latest with what's happening in our Child Life On Call community and keep up with parents and just hear some amazing quotes from some of the episodes that we've been able to publish. A couple of quick housekeeping things before we get started. If you didn't know, earlier this year, I wrote a book for toddler, preschool, and young school agers called the Super Silly Wash Your Hands Dance Book. The book is available on Amazon, and we've recently published a Kindle edition. The book is super fun and colorful, thanks to H. Kate Designs, who just designed the cutest little animals for this book. And it's really easy to remember when kids are washing their hands. So kind of the purpose behind it is that as kids are washing their hands, they can do the little dance that the book talks about, and just kind of keeps them there for about 20 seconds and the different steps to do. But I really love the book because I think it's great for NICU siblings who parents are bringing babies home to siblings, and we know that hand washing is such an important part of that. Not only is it the time for a pandemic and we really need to teach our kiddos to not just wash their hands, but actually do it the appropriate way and the reasons that they should. And also for transitioning back to school. And so kids, as they're going through the classroom and if they're going back to in-person school, I just think it's a really great way to empower kids to wash their hands and, of course, dance. Okay, so enough about that. Let's get to Amrita. If you are a parent, chances are you have had baby spit up. This is incredibly common, but can actually become more severe. You may even receive a diagnosis of reflux or even silent reflux. And while this is a fairly common diagnosis and children do tend to grow out of it by about 12 months, sometimes the cases can get more severe. And Amrita is going to share with us her experience as a first-time mom and a baby with severe reflux called gastroesophageal reflux disease, or GERD, as you may have heard before. And her son ended up with oral aversion and a feeding tube and a lengthy hospitalization, and is currently seeking different type of therapies to help with those oral skills and feeding skills now. Amrita walks us through what navigating her journey has been like, and at the end of the episode, she talks about what moms with infants who have reflux should be on the lookout for, so it's really valuable information. She is her son's biggest advocate and champion, and he is just so lucky to have a mom like her in his corner. So let's get started.
So we are from India originally, and my son was born in 2019 January, on 14th of January. And we came to Canada in 2018 March from US. We stayed in US for around 6 years. And then we were planning to have a baby, and we had our son in January 2019 in winter. And so we were 3 of us in our family, and rest of our family is back in India.
Okay, gotcha. It's always hard to be away from family, especially what you guys are going through and being in a pandemic. It just adds so much stress, and I know you probably wish they were closer.
Yes.
Why don't we talk a little bit about your son and kind of why we're here today. And I'm so glad you're here to share your experience, because I don't think people realize how prevalent this is and how severe it can be. So why don't you start off and talk about kind of your experience with your son?
So after my son was born, when my son was born, he was a regular full-term baby without any medical issues. He was discharged to home, and I started breastfeeding, and he was partially breastfed and partially fed on formula. So, but as time went by, he preferred bottle. So we switched on to bottle feeding. So he was fed on formula and on pumped breast milk. So initially there was no issue regarding any reflux. There was a little bit of spit up, which all babies do. But around like 2.5 months old, he would have this episode for like 2-3 days at a stretch when he would refuse to drink, and he would like arch his back, and he would like cry whenever he would see the bottle. And it would be extremely difficult to feed him or offer him the bottle, and his like milk volume would just drop down to like barely minimum to keep himself hydrated. So he was like this, and he looked like he was in distress and pain. So we were not much aware about gastroesophageal reflux disease as such. We knew that kids at this age, like infants, do have reflux because the milk backs up towards the esophagus and they spit up. As the system is developing,
Right.
the stomach is still small and all that. So when we discussed this with our general physician, who we first were seeing, consulted for our son, so she said that all babies go through some amount of reflux in their infancy, especially up to around 6-7 months old. But then when they start sitting up and their tummy becomes bigger and the digestive system develops more, then it reduces on its own. So she did not give any medication. But these episodes of like completely food refusal and like being in pain, it kept on happening like once in every 3 weeks, and then it became once in 2 weeks, to the point that when he was around 4 months old or 4.5 months old, he started vomiting. And it was like at least one time or 2 times in every day he would vomit, and it would be like raw milk. So when we discussed with our general physician, she said that she suspects that he might have a more severe form of reflux. So she referred us to a pediatrician. And so when we took him to our pediatrician, he said that he is having GERD, or gastroesophageal reflux disease, because it is not just regular reflux. It is more than that, and it is much severe since he's vomiting, and he looked like in pain as well. So he gave us medication. It was just once a day, and it was the lowest, I think it was the lowest concentration for the medication because he was very young. His weight was also pretty low. So, and he didn't want to make any more changes in his diet or give any more medication for stopping the vomiting, because he wanted to see how his body reacts to the reflux med. And he also said that reflux med is not going to prevent the vomiting. It can only reduce the pain to a certain extent. So initially when we gave the medication, he was doing pretty well. For around, I think, for a month or so, his vomiting reduced a little bit. It didn't completely stop, but it reduced a lot. Like it might happen like once in a week or so. So it was good. But later on, around when he was close to 6 months of age, he was around 5.5 months, he would again have this kind of episodes when like around 5 o'clock or 7 o'clock in the evening, he would start crying hysterically. He looked like in pain, and like he would not arch his back at this time because he was pretty big. So it was difficult to understand, but he would like cry inconsolably. I would do whatever it takes. I would like pat his back. I would do the cycling in his tummy and keep him straight, but he would just keep crying for about around 15-20 minutes without continuously without stopping. So at that time, I did not think.
That's so hard to see.
Yes, because
as a mama, and it's just like you try everything and nothing is working. It's so difficult.
yes, because I have no idea that why is he crying. Because I gave his meds, he was not overfed, and he used to sleep on my lap at that time. He used to take his afternoon naps on my lap or on my shoulder. So yeah, it was pretty hard for me because I was completely clueless. I asked my friends and who have babies of that age, and all they said that they could think of only teething because they sometimes since the baby is very small and maybe they are teething, that's why he was crying like that. And even I took heart of it because it looked like the most logical reason at that time. So I did not do much about it, but after a few days again, he started vomiting. So there was vomiting and there was crying. And then when we took him to our doctor, he said he might be having he said that it is not due to teething. He's not teething at all. It is most probably due to his reflux. So he increased his medication a little bit, and he did not make any other changes because he also started solids at that point, around 5.5 months.
Right.
So he was on a slightly increased medication of lansoprazole, and he was fine he was just doing good for few days. But then somehow when he was close to 6 months, and it was around the weekend of Canada Day, the long weekend, that he started refusing to all his bottles. And it was it started from his dinner time bottle, and it went to his the 5 p.m. bottle, and it only aggravated his refusal. It became more and more dominant. And since it was long weekend, so we had no idea that where to go, and the only place was emergency. And so after it started the weekdays following the long weekend. So it was around 4-5 days that he was completely refusing to drink, and he dropped 50% of the volume that he was drinking usually. So and at that time we couldn't get a appointment with our pediatrician, and because of that, all of that, we were very much worried about his hydration. And he stopped pooping as well because he was not well hydrated, so he stopped pooping. For around about a week, he did not poop. So we went to the Mississauga hospital where he was born. We went to the emergency, and they kept him under observation for around for a whole day. I would say around 8 to 10 hours. And he had a temperature at that day, so they kept him. They did a lot of tests, which came out negative. So they all said that they suspect only teething, and they had no idea about whether it was because of the reflux or a severe case of reflux. So he eventually he was drinking a little bit to keep himself hydrated. So they just let us home as they saw a good diaper for a few hours. They watched that he had 2 good diapers, so they told us to go back home and start giving him the bottles if he accepts, and see what he does in the next few days. So time went by, and then by another week, he dropped a huge amount of whatever he was drinking again. And this was barely minimum, around I think it was around 10 ounces or around 10 to 12 ounces in the whole day. And by this time, he already dropped his weight. And we took him to a pediatrician post the Canada Day weekend. And he told us that he might be having bottle aversion and food aversion because of all the things that is going inside his tummy because of GERD. So at that time, nobody thought that he would get a feeding tube. He told us that many kids end up having a feeding tube if they completely refuse and their weight keeps on dropping. So he just said that make sure he's hydrated, give him like maybe milk mixed with some oatmeal, anything that he's ready to take. But nothing worked, and and like by couple of next days, he was like completely refused to drink, and he was like barely hydrated. So our doctor told us to just go to the hospital and get himself admitted. And so when we went to the emergency, that day from morning, he had, I think, only around 30 mils, like 1 ounce of milk here and there. And that's it. He did not drink anything. So in the afternoon, around late afternoon, we went to the hospital. And then initially the doctor there suspected that maybe because of constipation, he might not be drinking. But he was constipated otherwise because he wasn't hydrated well. I mean, it's like a vicious circle. It keeps on going.
Right.
So,
oh, it's like one symptom leads to the next. And I just keep thinking about you right now and the sleeplessness and exhaustion and emotional pressure you must have been feeling as you were going through all of this.
I mean, yes, it was like, I don't know how I went through it. It's just like I went along the flow and I just wanted my son to get out of it.
Yeah, it's like you're in tunnel vision, like figure out what's going on, get it done, do what you have to do.
Exactly. I mean, I had to do what we had to do. So
right.
We went to the hospital, and the first they did was the X-ray of his colon or rectum. I don't know. I'm not sure which one, which shows that whether he had stuck poop inside his system. So there was some. So gave him a suppository, but he didn't poop for around, like, I think 48 hours. The poop came out as an extremely hard and like it looked gross. It was black and it came out after like 48 hours of giving the suppository. And
poor babe.
Yes, and he was like almost sleeping all of the time because he was obviously not hydrated. So,
right.
So after they did the X-ray, they also did the test for his sodium level, I guess, and a couple of other tests. And the most difficult part was seeing him crying because it is very difficult to find the vein on his hand. So, and his hands are like, his hands are extremely tiny. So the first set of the people who came in from the emergency department, they completely failed. They struggled for around 15-20 minutes to find the vein because they couldn't, because they wanted to make the channel initially, but they couldn't. Then another set of people came in. I think they were from the NICU, who then helped to get it, and it was a huge struggle, and we kept crying that whole time. It was such a trauma for him, and seeing him like that, it just breaks your heart when you see your child like suffering, but there's no other way out until they do the test. So
right. Oh,
after that,
did they have you did they give you any suggestions about how to help him during it, or is it kind of one of those things where it was all hands on deck and you had to stand back and watch it, or how did that all work?
Yes, we had to stand back and watch it because I mean, they would just try it for like around 10 minutes, and since he was crying so much, so they would just go on, and they would say, just give a break, you just like comfort your son, and then we might come back after half an hour or 1 hour. So
okay, good. So they gave him a couple of breaks and let you hold him and stuff. And, you know, I think it's easy for clinical workers to just want to get it done because they want to get it better. But taking those breaks are important and makes a big impact so that he has time to rest with his mama and you can connect with him again and then try again.
I think one of the doctors came in. She was from the emergency pediatric department. There are two departments for regular patients and for the babies. I mean, for the kids. So the doctor in charge, she came in and she examined him, and so she asked all the questions about how and what happened, and kept repeating the same things, that from last 2 weeks he refuses food, that he's not drinking. He is already on reflux med. So around all of this was happening, and around I think it was at almost evening 8 o'clock when the pediatrician came in, and he just asked everything, and I just said him that he's severely aversive to drinking or eating anything, and he is he did not have a diaper at that time at all. So they said that immediately give him to put him on IV, on Pedialyte. And so we were taken to the two-way department, and they tried to make the IV there, and then they struggled as well. And then finally it was around 9 o'clock or 10 o'clock at night that they finally put the IV in, and he was set to get hydrated. So since it was weekend, so the therapist was not available. And so over the weekend when we were in the hospital, the doctor in call, he told us to just keep him offering the bottle, followed by some solid food like oatmeal or the purees he used to eat. And we offered him, but he just completely refused to take anything. So the head of the department, Dr. Chan, he came in, and the occupational therapist, she also came in on Monday. And they asked the whole history. We said that, and at that point they explained that sometimes if this reflux goes out of control, if they have the gastroesophageal reflux disease, then it happens because they feel a lot of pain in their tummy, a lot of discomfort together with the vomiting. It's a very bad experience for them, so they associate the pain with eating. So whenever they're eating or drinking, they are in pain or they are vomiting. As a result, they would refuse to eat or drink, because if they don't eat or drink, then they would vomit or they would feel discomfort. So they also said that it would take a long time to get back him on, till he gets back on drinking or eating, because it is mostly led by the child. You cannot pressurize or force him to do anything. It is based on whatever he feels, whenever he feels safe or he trusts the food, that he will take it.
Right.
So they put him on.
So it's like you have these instincts to want to feed, and give him what he needs and what he, needs to survive. But they're saying take a break. It's hard to get it's like rationally you can understand it, but it's hard when your mom and your instinct is to feed them. It's very difficult.
Yes. So there was so much of struggle mentally that we have to take a step back and feed him. So when the occupational therapist, Myra, she came in, she said that do not offer him too many times, because the more times you offer, he might feel more pressurized. So only offer him the bottle or the food only in every 3 to 4 hours, only once in every 3 to 4 hours. So it's 4 to 5 times in the whole day. So we were doing whatever she instructed in his therapy, and there was a lot of playing around with food. And at the same time, the head of the department, Dr. Chang, he also said that since he lost more than 10% of his body weight, he lost a lot of weight in the last few weeks, in which he was completely refusing to eat. So he said he needs a feeding tube, because there's no other way out, that he would put on weight without taking anything orally. So that was another struggle, because we had no idea what an NG tube is, or what are the pros and cons, what are the risks involved, or what it does. So we were explained about it by the nurses. But personally, if you see a child with an NG tube, you would understand that it is not a very comfortable experience for them, because it goes through their nose, through their food pipe, inside their tummy. So there is always a certain level of discomfort. But that was the only thing that could have helped him put on the weight and put on some nutrition inside his body. So that was done with a lot of difficulty, because he is extremely resilient. and which is very obvious because
Yes.
you're trying to put something inside his nose without his permission. So obviously he was going to resist. So
Right.
there was that. And then there was this challenge of him vomiting because the vomiting keeps coming back every time. So he was initially, after giving him the NG tube, he was put on continuous feed, and it was a pretty heavy amount of formula for him because he had to put on the weight. Initially, he had to recover the amount of weight that he lost. So the first few days when he was put on continuous night feed, he did vomit a little bit. It wasn't a lot, but there was still a little bit of vomiting. So after a couple
Right.
of days, they broke it up into a smaller bolus feeds, and they reduced the flow of the milk. So he was on bolus feed. It was around 200 mils, I think, and it was done in 1 hour. So at that time, he did not had any much vomiting. There was some spit up, but not much vomiting when he was in the hospital. But after we came back home, I think it could be because
How long did you end up staying there? Do you remember how long
it
the
was, I think,
hospital stay
around
was?
3 to 3.5 weeks of stay.
Wow, that's a long time.
Yes, and we really did not expect to stay that long because I thought that maybe somehow you would start drinking, but it doesn't happen like
Right.
that, unfortunately. So, because we were
No.
in therapy, so we were doing lots of food play. The child life specialist, Alex, she helped us a lot. She helped my child. She helped Rayansh, play with the food, do some sensory things. And he would at most take a couple of spoons of like carrot puree or maybe some oatmeal, and that's it. At that point of time, that was his only oral intake. But he was not
Yeah.
interested in taking any bottle, any CP, not even water. So by third week, by the first week, the hospital nurses, they managed everything, the continuous feed. And on the second week, he was transferred to bolus feed. There was one feed in the evening before he went to sleep, and there were 3 feeds at night. After that, on towards the end of the second week, we were given training. It was mostly me who was doing all the things of like changing his dressing and all that. So I had to learn this because I am the primary caretaker of my child. So I had to learn the things of how to give the gravity feed with the big syringe, and how to flush in water, how to check the pop and the pH, and how to do the dressing. The most difficult part was the dressing because we have to keep him
Yes.
in laying down position and change the tapes and all those things. So that was very difficult.
And that's painful for him too. Like, whenever tape comes off and has to get put back on and you're doing all this by yourself, that's a lot.
Yes, it's a lot for me, and it was a lot for him, especially for him, because
Yes.
many times he would
Yeah.
pull out the tube halfway and have to again put it inside and
Right.
again take it in. So, and that would happen like every day, at least one time that he would take it halfway and I have to put it back. So that is not a nice experience to feel for him.
Oh.
So these are some of the challenges that we faced for the NG tube. And apart from that,
Right.
there was also a lot of gagging. As long as we had the NG tube, there was a lot of gagging. And there was vomiting as well, as I mentioned in my notes, that like when after we came back home, around a week or later, he started vomiting at the night feeds. Towards the end of the night feed, when we would flush in water, he would vomit up. Like it would be like raw milk, and like we really did not know what to do at that time. And he again lost some
Yeah.
weight because we went to our pediatrician and he weighed him, and he again lost some amount of weight, like around, I think in 2 weeks he lost around half a pound. So again we were like back to square one. We were back to wherever we were, and it was like it was like I was like in completely dark. Like it was like I didn't know what to do. Like and whatever weight he gained, he again lost the weight. So at that time, our
Yeah.
pediatrician, he gave him the other medication that is for emptying his stomach contents faster, domperidone. But he also said that sometimes it causes a little irritation on the stomach lining. So he was a little conservative about giving it. But and he said that if we don't need to give it, if he's not vomiting, then not give it. But we eventually had to give him every day because it was much better with that medication. And he was again given another medication for his reflux, that Ranitidine. So he was on 3 medications, 2 for reflux.
It's always hard when they're like, this may help you, but it might hurt something else. So it's like, it might help progress on this one, but the next, the other symptoms, it's difficult.
Yes, because you know that it's helping him on the inside, but on the outside, it's not a pleasant experience for him. These things all added up to maybe the sensitivity issues he has now. So, but he needed it at that time. He was also on the Restolax, the laxative, which we used to give it at his nighttime bolus feeds. So, with those nights with the vomiting, they were the worst nightmares in my life. Because what I had to do, he used to sleep on a wedge, and I had to cover him up like he was on a blanket, and I had to again cover him up on top of his blanket with a oilcloth, so that the blankets don't get wet. Because every time that the blankets get wet, I again have to wash him, and I don't have that many blankets to change. Sometimes he would vomit twice in a night, so I had to wrap him up twice, like a burrito, so that because the oilcloth, it soaks in all the vomit, and it doesn't get inside, seeps inside the blankets. So even I now remember, even after we stopped him feeding, we stopped the bolus feeding, and he was just on water hydration towards the end of his tube-fed journey. I still used to put those oil cloth. I really don't know why.
Yes.
But I just used to, I was so much scared of the vomiting that I just used to put them, hoping that he just won't vomit. So.
Oh gosh, yeah. Well, and it's once you have a system that works, it's very hard to break out of that system. It's even with a swaddle. It's so hard to get away from the swaddle when it works, and it's you don't want to mess anything up or change it.
Yes, but unfortunately, the thing is that once your child starts on tube feeds on a certain amount of calories being fed to his body every day, then his motor skills and his urge to eat, or his hunger, it reduces, because his body is already getting that amount of food that he needs. So even though I was offering him food and the bottle every day, 3 times in a day, he would only take a few spoons of maybe chicken puree or whatever, oatmeal or multigrain with his breast milk or formula, and that's all he would eat. It's not a source of nutrition that you can count on. So the next challenge we had, after his weight kind of stabilized and his vomiting reduced a bit, was to get him off the tube. It was a much bigger challenge because of the fact that his body got used to all that tube feedings that he had. So the biggest challenge that we faced during his weaning from the tube feeding was that he was on night feed, so he was sleeping when he was fed. So our dietitian, she converted them to morning bolus feeds. So the schedule would be that before first you offer him the bottle, then you offer him the food, and then when he doesn't eat anything, you just put the bolus feeds. So initially, when we changed it to daytime feeds, he again started vomiting. And at that point of time, he was teething back to back. Few days in every 2-3 weeks, he would be teething. And whenever he's teething, he again vomits.
Yeah, it's like the teething prophecy finally came through in the times where he wasn't vomiting. Poor babe.
So, so when we initially started the pre-weaning process, which is like converting from night feeds to daytime bolus feeds, he was teething and he also had a cold. So he started vomiting. So we again had to stop that and we had to go back to night feeds. So every time there's something which causes him discomfort or he's sick, we had to go back to the previous step. So like this, where the first thing that was done after I think around 2 weeks, these things settled down a little bit. And so that the first thing that was done for tube weaning was reducing his tube feedings, the volume of his feeds. So I do not remember the exact volume that were reduced, but from each feed there was a certain amount, like 2 maybe out of 8 ounces of bolus feed, 2 ounces were reduced. So it was around, I think, of the total volume, 30% was reduced as the first step. So initially, when there was in the first step, when the tube feedings were reduced, there was no response for him. He is a very strong-minded child. He has his own will. Mm-hmm. So
yes,
he still doesn't care for drinking anything because he was actually very well hydrated. He was having really good diapers, and he was still putting on weight. So his body, I think, did not need those nutritions. I mean, his body, I think, was still being fed enough so that he survives. And he was still eating like just a few spoons of purees. And there was a lot of playing around with the food. And after his feeds were reduced further, I think in the next step, he then started licking the spout of the sippy cup. That's all. And it was extremely slow process because it is led by the child. Mm-hmm. Some kids, they start drinking off from maybe the first step, and some kids even like drinking. He never came back to formula or milk ever. He now drinks sometimes he drinks some juice or Pediasure, but not like any kind of dairy-based milk. He won't drink it. So during the second step, and it was I think around second month of our wean, or like around 1.5 months, that he started taking a few sips from something called a honey bear cup. So it's like a straw cup which you can squeeze, and when you squeeze it, there's this the straw is something which they can chew on. It's like a silicone straw. So when you squeeze it, it puts the milk inside their mouth. So he opened his mouth finally for something, and for the honey bear cup, he opened his mouth and he would take like 1 or 2 sips, but he would not suck on the straw. I have to squeeze it. So this went on for I think another week or 10 more days. And
oh my gosh.
So at this time, his only solid intake of his purees went up. And the therapist didn't wanted to make any more changes for his diet at that point because he was already weaning. So there may be too many stress points for him. So they didn't wanted to introduce any new texture at that point, since he was at least eating something and drinking few drops of formula. So they didn't want to make any more changes at that time. So his solid food, his purees, the volume of the purees increased, but he wasn't much responsive to drinking. When we reduce the feeds further in the third step, I guess, at that point, we introduced a new sippy cup. It's like the toss and take sippy cups. If they come in like multicolored, a set of 3 or 4. And the thing is that if they bite on the spout, the water or the milk comes out. So at that point, we were offering him water every day. So he somehow started biting the spout and taking water from that cup. So it was like the moment when I finally saw some hope that he might start drinking. Yeah. Because at that point, hydration was the bigger concern. because he need to drink something
Right.
for his diapers. Because at that point, his weight was also, he lost little bit of weight because of weaning, which is an expected result. One of the outcomes of weaning is that
Mm-hmm.
the baby might lose some weight. And he was losing little bit of weight, but it wasn't too much to be concerned about. But he did started learning a little bit of the skills, and so he started biting the spout, and the water would come up, come like the water will squeeze out of the sippy, and you can also like squeeze it. Squeezing it also, it spills some of the liquid inside his mouth. So that way we were kind of able to keep him hydrated, and with a minimum amount of tube feed that he had. So slowly he started taking a little bit more water, and that way we were able to, at some point we were told by the therapist to stop the tube feeds because it is just not making him any more hungry and thirsty as well. So we stopped it. At some point you have to bite the bullet because it is like the step that you have to go. So there was zero tube
Right.
feeds, like 0 calories through the tube. There was only hydration. We were only giving him
Okay.
the water mixed with the Miralax. He was still having his medications at that time because sometimes
Yes.
he would throw up because of the teething, or I don't know whether it was reflux or teething, I'm not sure, but there was still a little bit of vomiting left. So he was around 12 months, I think around 12 and a half, when we took the decision of stopping the calories through the tube. So we did that, and we stayed on that step for around a month, around till he was 13 and a half, when we took the decision of taking out the tube, because he was taking enough calories to like just maintain his weight and be enough hydrated. So during that time, when he was like around 11 to 13 months, he would take out his tube so many times. Like he would completely take out his tube. And there were days when like once in every week we have to go rush to the hospital just to put the tube back in. And at that time, he was so agile because he was pretty much big enough to understand his surroundings. So whenever we would enter into the treatment room in the pediatric department, he would start crying hysterically. And it would take all the nurses and the
Oh.
child life specialists to like calm him down and like show him bubbles and the lights and all the sensory things to calm him down and put the tube back in. So when he was like around 13 and a half months old, we just thought like since he's taking enough, and he was kind of hydrated well without the tube, having more or less around diapers to hang in there. So we just thought that we are not going to put it back. One night when we were giving him bath, it just came out, and we didn't put it back in. We consulted our pediatrician and our therapist as well, and our nutritionist, and they said just watch it. You can put it back any day if he's not taking enough calories or if he's not hydrated well. So we watched him, and thankfully he just started drinking more water at that time, and he was well hydrated. And after that, we never put the tube back in. So,
Wow.
but this was not the
That's
end.
that's huge.
Yeah,
Were you happy to have the tube gone
yeah,
from your life
yeah.
forever?
I'm so thankful for everyone like that it's gone forever, and I just don't want any
Yes.
situation where it needs to be put in
Yes.
anymore.
Yeah. Oh. And so what do you think has helped him the most? You talked a lot about kind of building the foundation building blocks and not pushing things too fast. What are some of the things he really responded to in a positive way that you think helped him?
I think the things that helped him was, first thing is offering him food or drink without any pressure, without any expectations that he's going to take anything. There would be any intake of volume. Without any expectation, if you give, there won't be any pressure on him. If he plays with the food, let him play. If you want to spill it, let him spill. Let him do whatever he wants. So I think that was a very big point, and not over offering. And another thing is that uh,
Right.
I think it was there was a lot of support we got from our team, uh, uh, who helped us, who gave us a lot of tips regarding, you know, about offering him different textured food to play with. Like he would play with the Cheerios, he would pick them up and like throw them, or sometimes he would even lick one or two of them.
Yeah, and that's huge. I mean, for your son who wouldn't even open his mouth for
Yes,
something to want to lick a Cheerio, it's like you get so excited about those
yes,
moments.
because there was a time when he was on the tube, especially from like the time it all started happening till around 10 to 11 months old, he would not even put his finger inside his mouth or not even his toy inside his mouth. He would not even like kiss anything.
Yeah.
So it was like that. And from there to like letting him put anything inside his mouth, it was like huge. And like he even let us put a damp cloth inside his mouth because he was teething, I guess. And
Uh-huh.
my husband, like, he put a small damp cloth and rubbed his gum, and we were like, wow, that's a huge change. That's a huge progress that he made. And I think he was around 12 months old around that time. So I think the reducing the feed after after he was like 12 months old, that also helps, because if you are like always fed with a certain amount of food, you will feel the little discomfort. After the tube was gone, it was much better because he stopped gagging. His gagging stopped a lot. His gagging, his
Oh,
vomiting, they
yes.
all stopped after we removed the tube.
And so how is he doing now, and what are you guys doing for him? What's his feeding look like?
So even now we have a lot of things to do because uh, he has sensory integration disorder. He has a lot of sensory issues, and because of that, he's still having mashed and softly pureed food. I try to add new texture to his food, but there are certain things he doesn't like he doesn't like egg white. Even if I grate it, fine, he still doesn't like it. He doesn't like the texture of rice. So there's that. He also doesn't like playing with sand or anything that is dry texture, any kind of dry or grainy texture. He just went off
Mm-hmm.
like. And because of that, there are certain challenges we are facing regarding his eating, and he still does not eat like fruits or like whole fruits or whole veggies. I still have to like grate them or like mash them. But he had made
Right.
some progress because he is at least like initially when took him off the tube, he would only eat the purees, and whenever we are going to try a family meal or trying to offer him the food that we eat, he would not even touch it. Like if we are eating noodles
Right.
and if I give him one strand of noodles, he would like just take it and throw it off. Like he's like scared of it. I don't know what. Like it's because of his
Yeah.
sensory issues. So he would not even touch it.
Right.
But now, like even like last few days or I think around last 2 weeks, he has opened up a lot. Like if we offer him the same food they're giving, he's at least playing with it. He's like fishing his hand inside. He's even feeding me that food. So I think he had come along. He has made a lot of progress, but there's still a long way to go.
Well, it sounds like you've done an awesome job kind of being his advocate and making sure that he had the right people on his team and that you were following what they said. That's huge. It's easy to get overwhelmed in that position and not know what to do. Um, would you mind sharing with us what you would tell a new parent who may be, kind of at that 4, 5, 6 month old part that you were at before? What would you tell someone who's just kind of starting to go through this
So if a
experience?
parent has a child similar like mine who has reflux, the first thing is not to neglect it as a phase, not to take it off just it's just a phase in the child and it would go off on his own. If you see him consistently being in pain or in distress, go to your pediatrician, consult about what he might be going through. If he has reflux, ask for medication because he was not on medication till my son was 4.5 months old. So I think that has affected a lot because he was vomiting. If he would have been given the medication earlier on, then it might have helped him like to manage his reflux better. So do not ignore if your child is like crying, arching his back. It's not going to go off on his own. It will come back after a few days or weeks. So ask for medication, ask for medical help. If you see your child is refusing to eat or drink or take bottle, it is not a phase. Again, he is not going to just start drinking off magically, especially if you see him repeatedly refusing for a couple of days, multiple days, and if it only gets worse, go to emergency or your doctor. Ask about a therapist who can help him associate with food. Don't be afraid of therapists. They are not bad people. They are good people. It depends from one therapist to other how they approach the child. But the therapists I have experience with, they are pretty good people. They love kids and they are not going to force your kid to eat. They are not going to give bad experience. Don't find it a taboo that if you're going to a therapist, what people are going to say that your child is sick. Every child needs help in some way. No child is perfect. They need help either like maybe they need in eating or be it in terms of their behavior. If they need help, seek for that help. Don't think that it's going to go off on its own. And I think if a child behaves in distress or he's in pain or he's cranky, there's always a reason behind why he's behaving that way. It's always not about just a phase. Many parents, like I know, I'm not judging them, but sometimes they just shrug it off that, oh, this is just a phase, he's going to be just fine. But the parent who has a child, who has a specific, the child, if he has a certain medical issue, they only know that it's not a phase. So just don't be scared to get the help. Ask for whatever help you need.
I love that suggestion too. And we can blame ourselves a lot. And sometimes that's the reason you don't want to ask for help, because you're like, well, maybe I've done this and I need to fix it. But just being aware of it and then finding the resources that can help you. I love that advice that you gave. Amrita recommends Facebook support groups, one that's called Home-Based Tube Feeds, another one called NG Tubes Going Through Weaning. And if you'd like to connect with her or talk about any of the things she's mentioned today, you can find her on Instagram at Amrita1920, that's Amrita, or on Facebook. And I will link to both of those things on the show notes page. Thank you so much to Amrita for sharing your story today. If you know a caregiver who suffers from a child that has severe GERD, please share this episode and let them know that they're not alone. And you can see all of the little things that they had to do to go through the weaning process. And then just when mom becomes nurse, it's a lot to deal with. So knowing someone else is going through it too is really helpful. Stay tuned. Next week, I have a different kind of episode where I have Jamie Gentili back with a special guest. And thanks so much for listening, and I'll talk with you soon. Bye.